Good morning. Good. So the question what has been asked was, how do I diagnose Neuro-Wilson disease? I don't think there is something called as Neuro-Wilson disease, which Wilson disease is Wilson disease, and we all go ahead and diagnose in the same way. Probably the symptoms, the way they present is quite different. That is how we try to look into it as such. So before I thought how I do diagnose the Wilson disease, what is the Indian context, how things have been evolving in the Indian context as such. If you can see, the first case report of Wilson disease was published by Wadia NH in 1963. This was almost like 50 years after the initial description of Wilson disease by Wilson himself, where he called it as hepatolenticular degeneration. However, for first 50 years we didn't have it, and Wadia, when he published this case series of a family, he told that Indian context. After that, Dastur and Wadia came up with another couple of pathological series also, where they clearly told that yes, Wilson disease is in India, but probably we had an osteomuscular form of Wilson disease as against any other type of Wilson disease. Probably this type of Wilson disease was common in India. And this was the point which started trigger. It was that like a fusion reaction trigger started, and different centers across the India started to participate. And some of the centers started to have their own Wilson disease clinic. Probably Nemans is one of them, where we had a very big series over a period of time which has been accumulated. Probably I should tell that Dr. Wadia was somehow was a triggering point for that, because when I was going through all the records of Wilson disease patients, we could notice that the first case, which was the first or the fifth case, I don't remember the number, which was referred by Wadia himself there. So you can see this. This is Dr. Professor H. Satyanarayan Swami, who was the one who initiated the concept of Wilson disease clinic, and he was the one who tried to put together all Wilson disease patients at Nemans, and after that there was no looking backwards. And currently the Professor A.V. Talley and Professor Sanjeev Sinha is here. These are the pioneers who are completely taking almost for last 20 years. These are the people who are looking after the Wilson disease clinic and extensively managing it. This is one of the Wilson disease clinic, what happens in Nemans, you can see there. And this is me when I was even a project officer, I think, when I was working on the Wilson disease, I was sitting there in the Wilson disease clinic. Quite a deja vu phenomenon. You can remember how things have been changed over a period of time. And you can see this lady. This is the first family of which belongs to Professor Wadia. She has been prolongedly followed up in our institute for almost 30 years. She was there because they moved from Mumbai to Bangalore, and Dr. Wadia wanted someone to follow up. She had referred him to Dr. Swami, and that's how we had a long association. We have, like, it goes like a picture story for us when we went through each one of the cases, how things have been happening over a period of time. So this is a trigger. Now we have come to a point where things are in auto mode in Nemans, where things are managed, and we have our own extensive data on that. But the question still left remained is, why?
Shira. 1, 2, 3, 4 on the count.
Before I go ahead, how many of you are involved?
5, 6, 7, 8, 9, 10.
25 तक का count check.
Okay, only couple.
Then girls,
Just to tell.
14, 15, 16, 17, 18, 19, 10, 10,
Young boy comes with any young boy coming with
ఏం క్లాస్ చదువుతున్నావు?
such a nice smile on the face. You can see his face. Can you replay the video once again? Or I can play it here. So, any young
Shira.
boy
1, 2, 3, 4 on the count check.
which having such a nice smile. First, that only
25 तक का count check.
all urologists say Wilson disease. All other diagnoses are secondary, tertiary, or whatever you want to call it. Any child extrapyramidal comes with this law, you don't think anything else. It's very simple, straightforward to think that yes, Wilson disease is in this child, young child,
ఏం క్లాస్ చదువుతున్నావు?
coming with a dystonic smile or extrapyramidal symptoms, you go ahead, you diagnose, you send for a copper slit lamp, perfect. You have a diagnosis. So there is no need for me to talk about Wilson disease anything further as well. But let us go back and see what has happened. This is Dr. Walsh here, who is probably the father of the modern treatment of Wilson disease. He was the one who pioneered the penicillamine. BAL was one of his things, and then Trientine was discovered by him. But everything about penicillin was done there. What he wrote was, in his 1992 landmark article, there appears to be only one thing which all patients have in common, apart from the Kaiser-Fisher corneal pigment, namely that they are all different. That means clinically, no patients are same, the way they present. If it was as easy as that patient comes to you like that, you make a diagnosis, you are lucky enough. Because we have gone through the records, it's not just the general practitioner, physicians and specialists, even so-called very good neurologists, very good clinicians have missed the diagnosis of Wilson disease. It's not that they couldn't miss it, but at that point of time, that suspicion didn't come in, because this is what it had, namely that they are all different. So that's what we try to remember here. Neuro-Wilson's is a very odd presenter, because jaundice in a young patient, probably from a hepatology point of view, you may consider it as a first differential diagnosis, but neurological, there are hundreds of differential diagnoses and depends upon how it is done. These are the two. I'm not going to, please don't read it, I'm just going to tell two stories here which have been published. This was how the things happen, why people miss it out. This case one is a 29-year-old lady, apparently went till about 4 years back before the onset of symptoms, started to have some behavioral issues. Very good. So went ahead to a psychiatrist, started getting treatment for that, and all various antipsychotics were given. Then she started to develop extrapyramidal symptoms. So she developed extrapyramidal symptoms with antipsychotics. Simple for us, we call it as drug-induced movement disorders, drug-induced tardive syndrome. Go ahead and treat it. So she was treated for that, and what happened? Her tremors started to become more prominent. For that, she also went and met a neurosurgeon. She underwent a stereotactic surgery, means lesioning of the thalamus was done. She underwent thalamotomy to reduce the tremors, for which she was treated. But however, her behavioral symptoms start worsening. That is when she was evaluated, and retrospectively looked into it. Everywhere it was written as Wilson disease. The only thing is, we didn't get a doubt at that point of time that whether it could be Wilson disease. So a high degree of suspicion, that is what is required when we try to look into it. This is another case. The second case is a 12-year-old girl started to have fractures of the leg, which was pathological fractures. Then she was on multiple casts when she had come to us. She started to develop extrapyramidal disorder. Go ahead, took about 2 years for us to diagnose that yes, she had Wilson disease. So if you look, every patient of Wilson disease, people have gone through various diagnostic phase, therapeutic phase before they have been diagnosed to have Wilson disease as such. So why do we miss it? Missing is common, and the number of diagnoses what has been published from people have symptoms. Let us say, because as Madam has asked, within a couple of sentences I try to explain, people who have abnormal movements in the presence of normal strength and sensory input, we call them, they are having movement disorders. In a simple terminology to tell it as. Like many people will feel that when there is a movement disorder, like is a fracture a movement disorder? Is a stroke a movement disorder? They are not movement disorders. You should have normal strength and normal sensory system, but however, your brain is not working well. So that is the cause of movement. You can have excessive movements, where we call it as hyperkinetic movement disorders. Excessive movements in hyperkinetic means you have tremors. You have small shaking, what you see, we call it as tremors. These are hyperkinetic. Patients have dystonia. Dystonia means tone is a muscle tone. It's an abnormal muscle tone. Muscles are pulling unnecessarily, leading to abnormal movements of the neck, body, hand. Depending upon which body part is involved, we give a name to them. They're like, neck means cervical dystonia, hand means hand dystonia. So dystonia is an abnormal tone. Then we have chorea. Chorea means it's a restless, fidgety type of movements, what you can see in this way. People keep on moving relaxedly. They don't know why these movements. When you see them, you feel that they're very restless type of movements. Similarly, we have tics. You see that many people, you may see even friends also, they have excessive eye blinking. They raise their eyebrows. When they are speaking, they keep on moving the shoulders or make throat sound. Did you understand me? Like that. So many of your friends, if you try to remember. So these are all different type of things or stereotypes, what we call it as. So movement disorders may be pathological or may not be pathological. That's what you need to remember. And we have slow, is the classical is Parkinsonism, where people become slow, stiff, they can't move, they take lot of time. So there are different types of movement disorders. So probably we need to take one extra class for that. We'll stop it at this point of time.
I think all these dystonia, chorea, tremors, and Parkinsonism like picture is quite evident that there is some neurological. But I think there are subtle points which are very, very important to understand, especially for the students and the pediatricians, to recognize this problem. For example, a child having poor scholastic performance who was doing very fine and now deteriorates. This is one point where one has to think of. Deterioration of the handwriting is very important. Then, if speech problems. For example, the child or adolescent was perfectly fine and suddenly some parents start noticing, oh, बच्चा बोल नहीं सकता है, कुछ problem है, there are facial expressions which he is making. Those are the points I think when we have to make the diagnosis, because these are reversible things. I think those are also important, because once you have a full-fledged disease developed, extrapyramidal signs, everything, everybody can recognize. But those are the subtle points which are very, very important to recognize once you have to recognize neurological involvement.
Yes, as I told you, it's missed. It's not that I'm not even talking about practitioners. I'm talking at people who are seeing Wilson disease also regularly. It's still missed. It has happened n number of times. So no question, high degree of suspicion is the only thing which matters here.
I think the important key is, as I think very well pointed out, scholastic performance, etc. So whenever you see such symptoms, I think in the modern era where MRIs are easily available, probably an early MRI would at least point to something. So I think as a pediatrician, if you see something, poor scholastic performance, poor handwriting, something that you're not able to explain at an early stage, probably an early MRI might save many years in the diagnostic challenge.
Before I wind up, a small question from me. As a hepatologist, we see that non-alcoholic fatty liver disease is very close mimic of Wilson's. Early presentation could be just fatty liver, could just be a fatty liver. And teenage generation, we have lots of emotional issues related to obesity, and Wilson's disease children may also be fat. So how far do we go in investigating at this stage? Maybe what is a fatty liver and emotional issues we relate to the obesity. It could be a early psychiatric manifestation of Wilson's. Would you expect MRI changes at this stage?
Look, usually pure hepatic patients may not have MRI changes, but usually what they tell is if you are clinically seeing a cave ring, most of the time patients will have abnormal MRI changes. Okay. So if you are able to see a cave ring on a naked eye examination, even though patient may not have a neurological symptoms, they may have MRI changes. Okay. So that is what you need to keep.
Thank you.
Dr. Sinha, just one very brief question and we need to close the session.
Yeah, just comment. Thanks, Prashant. One of the things, like whether it's neuro or Wilson's or hepatic Wilson's, the residents hardly ever asks for family history. And no family comes and reports that there is a family history. So we often don't do that. So if a good resident is there, have a habit of drawing pedigree chart, that in addition also helps.
Absolutely. Thank you very much.
Thank you.